The stall's locked. The light bursts overhead. The smell of bleach is sharp. You hear footsteps behind the door. A cough, a flash, and still nothing. You shift your weight. You try to breathe. You tell yourself, just relax. But your body doesn't listen. It holds, tightens, shuts down. And there it is again. Why can't I just do what everyone else does? Welcome. Hello. I'm Karsten Noack. As a therapist, I support people navigating anxiety, trauma, and the hidden struggles we rarely talk about, like Paruresis, also known as Shy Bladder Syndrome. What is Paruresis? Paruresis is more than hesitation. It's more than discomfort. It's when the body refuses to urinate, in case others are nearby or might hear or might judge. It's not about the restroom. It's not about hygiene. It's about safety and a sudden absence of it. What it feels like. Your bladder is full. But your nervous system says, not now. Your shoulders tense, your breath shortens, your thoughts speed up, your muscles lock. And the more you try to force it, the harder it becomes. Do this with me. Place one hand gently on your belly and one on your chest. Take a slow breath. Can you feel it? The subtle tension, the holding. And maybe you've lived with that sensation longer than you realized. Why silence makes it worse? People with Paruresis often say nothing, not to partners, not to friends, not even to doctors. They build routines around safety. They only drink a little, only go at home, only say yes to what feels safe. And slowly, their world shrinks. They're not weak, they're adapting to fear. But fear grows in silence, and so does shame. Especially for men. Most people who come to me for Paruresis are men. Often successful, often high-functioning, often deeply ashamed. Because somewhere along the way, they learned this. Real men don't struggle with basic things. But here's the truth. Real men feel fear. Real men freeze. Real men ask for help. Where it starts. Many remember the first time it happened. A locker room, a joke, a moment of pressure, a loss of control. The body remembered, and ever since it tries to protect you by locking down. Even the thought of failing again is enough to trigger the phrase. What's really happening in the body? To urinate, your body needs calm. The parasympathetic system says, it's safe, let go. But when fear strikes, the sympathetic system takes over. Muscles tighten, flow stops. Trying harder doesn't help. because trying itself becomes the trigger. You can't push through paruresis. You have to feel through it in a new way. The turning point. A client once told me, I flew to a wedding, but I never went inside. I couldn't use the bathroom on the plane. I sat in the parking lot for 2 hours and missed everything. 3 sessions later, he messaged me from a rest stop. I just peed outside my home for the first time in 10 years. Not because he forced it, because we helped his body feel safe again. So, what helps? First, check with a doctor to rule out medical causes. Then consider gentle body-based therapy, specialized hypnotherapy, guided exposure, relaxation techniques, breath, sound, movement. Learn to feel without bracing. Letting the body relearn what safety feels like. And why hypnotherapy? Because in trance, the mind softens. The body remembers new options. Tension fades. Control is replaced by trust. You're not forcing it. You're allowing it. Can you do it alone? Sometimes, but rarely fully. Because paruresis is not about effort, it's about safety. And feeling safe again is something we learn in connection. So what? You're not broken. You're not alone. You're not the only one who hides this. Paruresis isn't a failure. It's your body saying, this doesn't feel safe. Let's teach it something new. Karsten Noack. Let's walk this path together with breath, with courage, and with care. You stood in silence. Now your body is learning a new sound. Relief without fear.